Thank you so much for tuning into Fab Lab, where we make you fabulous. The topic of today's video is how do you prepare for your permanent makeup appointment? Some very important tips and pointers here, so make sure to listen up. So you have decided to make this beautiful change to your gorgeous face and get a permanent makeup procedure done. You could be either coming in for eyebrows, eyeliner, lips, or maybe even post-surgery areola reconstruction. So here is some important things to keep in mind before coming in for your appointment. First, we need to go over who is a good candidate for permanent makeup, because there is some definite contraindications and you want to make sure to pay attention to that. So number one is if you are an organ transplant recipient, you definitely do not qualify to do permanent makeup. If you are pregnant, you should wait until after you deliver your baby. And then if you're in general overall poor health, this is something that you should probably try to stay away from. There are a few other things that would prevent you from being able to get permanent makeup done, like for example, pacemakers, or if you have a major heart problem, if you have psoriasis in the area where you would like to get your permanent makeup done, if you have any sort of allergies to the inks that we use, if you are currently undergoing chemotherapy, or if you are a current cancer patient, or if you have issues with hyperpigmentations. If you have heart issues, kidney issues, anything along those lines, autoimmune diseases, you definitely would need to get a note from your doctor before we would be able to do a procedure. A few other things to keep in mind: you should not be putting any sort of Botox or any sort of facial fillers at least a month before your procedure, and then you should definitely not be doing any sort of facials or chemical peels at least a couple of weeks before your procedure. So that being said, if you have checked off no to all of those boxes and you are actually a good candidate, let's talk about what you need to do in order to prepare for your amazing procedure day. So before your procedure, at least 2 weeks before, you should get off all of your Retin-A products. You should avoid sun-tanning beds, saunas, things like that. If you're taking blood thinners, that should be something that you should start getting off of in preparation for your appointment. All the Botox and other facial fillers should be done at least 2 to 3 weeks prior to your appointment. And then definitely avoid waxing of the areas where we are going to be working. So the day before the procedure, no alcohol. Oh, I know that might be hard for some of you. And no caffeine the morning off. So I'm sorry, not sorry, but the problem with caffeine is that it actually makes some people bleed a lot more. So if you have more bleeding, that will suck out more of the pigment, and that you're going to be potentially left with some blotchy discolorations, because it's not going to be as even as it would have been if you didn't drink your morning coffee for the day of the appointment. And one of the things that I would really prefer you to do is to come in, if you're having your brows done, to come in with your eyebrows done how you usually do them, so that we can see what your preference is, to help us a little bit more with mapping and with setting up the expectations. So definitely, if you pencil your eyebrows and do it the morning of your appointment, so that we kind of have a good idea of what you're looking for. Okay, so you have done all of that, everything is checked off, so now you come in for your appointment. So depending on the procedure that you're choosing, you can expect different order of events. But usually what we do is we do a brief consultation at the beginning. We kind of discuss what your wishes and desires are and set realistic expectations. And we map everything out to make sure that you're really happy with the outline, and then we proceed with numbing. So I want to make sure that I'm not making my clients suffer. So we usually proceed with first and then also secondary numbing as well once the procedure starts. And depending on what you're getting done, the procedure can be anywhere from 2 to 3 hours. And yes, you can do multiple procedures on the same day. I've had some people do eyebrows and eyeliner at the same time, and that's totally your prerogative, but just make sure that you are setting up enough time in order to make sure that we're not feeling rushed and that we have enough time to dedicate to make everything as beautiful as we possibly can. I will make sure to take pictures before and after so that way we can see what a gorgeous transformation you have. And just keep in mind that at the end of your appointment, your procedure is not done. Every single permanent makeup procedure requires 2 separate sessions. And the reason for that is during the first procedure, we usually tend to go a little bit lighter, a little bit more conservative, just to see how your skin is taking the pigment and how you're reacting. And then on our perfecting session, which takes place about 6 weeks after, we can beautify everything and make sure that everything is exactly how you want it. Your procedure is not going to be done after that first session. You definitely absolutely have to do at least the second one, and then depending on your procedure, you might have to have touch-ups on a yearly basis or maybe every 2 years, depending on how much you sweat. After your procedure, what do? Well, when you go home, I highly recommend do not exercise. And some of you might hate me for that, and some of you might be really, really happy. The reason for that is when you exercise, you sweat, and sweat has salt in it, and salt pulls the pigment out. So that could lead to a little bit of discoloration of your beautiful new permanent makeup. So we definitely want to try to avoid that. And also, please make sure to follow the aftercare. I give everybody a small little baggie with your aftercare product and a paper with instructions that really outlines everything that you have to do day by day to make sure that we get the best possible result. So something to keep in mind is you could have the most experienced artists in the world with thousands of procedures under their belt, but if the client is not following the aftercare instructions, the final result will definitely not be what you expect it to be. So it is as much art as it is science. And we're going to try to make it as perfect as possible. But as we all know, our faces are not always perfectly symmetrical. One eyebrow can be higher than the other, or it could be starting off a little bit more in versus the other. So we all have our cute little quirks that we're going to try to make as symmetrical as possible. But it's really, really important to have the expectations set appropriately in order to know what you're getting yourself into. So pre-care, super easy. During the actual process, I'm going to make sure that you are really, really comfortable and that you don't feel pain. You're relaxed. It's going to be like almost like a spa day with a little bit of pinching on your skin every now and then. And aftercare is relatively simple. You will have a super easy outline to follow to take home with you. And then you come back 6 weeks later for a perfecting session and you are ready to rock and roll and have this hashtag I woke up like this look every day. So please let me know if you guys have any other questions. If I haven't addressed everything that you wanted me to, drop me a line in the comment box below, and I will see you guys at the studio. Make sure to book your appointment today, and until next video, stay fablabulous. Thank you guys.